For centuries, ginseng has been called a natural Viagra, a root said to restore masculinity, stamina, and sexual power. But when we strip away legend and marketing and actually test ginseng in human studies, what does it really do? Does it change sexual function itself, or does it simply change how people feel? Traditional belief and cultural context. To understand why ginseng carries such powerful expectations, we have to go back thousands of years. In traditional Chinese medicine, Panax ginseng was considered a high-tonifying herb, believed to restore life force, resilience, and vitality. Its name, Panax, comes from the Greek word meaning all-healing. Culturally, ginseng became associated with masculinity, longevity, sexual endurance, recovery from weakness or aging. Part of this belief came from symbolism. The human-shaped root was thought to reflect its effects on the whole body, including sexual energy. In East Asia, ginseng wasn't framed as a sex drug. It was framed as a restorative tonic, something that strengthens the body so desire and performance could follow naturally. That distinction matters. Because modern science didn't test ginseng as mythology described it, it tested it in controlled human trials, asking very specific questions. What science has actually studied? When researchers study ginseng today, they're not studying legends, they're studying outcomes. First, an important distinction. Much of the early enthusiasm came from animal studies, cell-based experiments, and mechanistic theories. These often showed effects on nitric oxide pathways, stress hormones, and fatigue markers. But animal results do not automatically translate to humans. So what happens when we look only at human clinical trials? Human outcomes. Studied researchers have mainly examined ginseng for erectile function, libido or sexual satisfaction, fatigue and energy, mood and stress perception. Some small randomized controlled trials, particularly with Korean red ginseng, showed modest improvements in erectile function scores compared with placebo. But these studies share important limitations, such as small sample sizes, short durations, subjective outcome measures, high placebo responsiveness. Systematic reviews repeatedly reach the same conclusion. Evidence exists, but it is limited, inconsistent, and not definitive. No large, high-quality trial has demonstrated that ginseng directly treats erectile dysfunction in the way prescription medications do. What about American ginseng? Panax quinquefolius, American ginseng, has been studied more for fatigue, glucose metabolism, cognitive performance. Its sexual effects are even less clearly supported than Asian ginseng. Again, no strong evidence of testosterone elevation or direct aphrodisiac action in humans. The misinterpretation problem. So why does the belief persist so strongly? Because correlated improvements are often mistaken for direct effects. Let's break that down carefully. Fatigue improvement does not mean sexual enhancement. Ginseng may modestly reduce perceived fatigue in some people. Less fatigue can make someone feel more capable or interested in sex. But that does not mean hormones changed. Blood flow pathology was corrected. Sexual function was directly altered. Some studies suggest ginseng can influence stress perception or mood. Lower stress can improve sexual confidence. But reduced anxiety is not the same as increased testosterone, and human studies do not show consistent hormone elevation. Vasodilation does not mean erectile correction. Yes, ginseng may influence nitric oxide pathways, but erectile dysfunction is often caused by vascular disease, diabetes, neuropathy, medication effects. Mild vasodilation does not reverse these conditions. This is where marketing fills the gap between what's biologically plausible and what's clinically proven. Safety, risks, and drug interactions. Because ginseng is natural, it's often assumed to be harmless. That assumption is incorrect. Cardiovascular effects. Ginseng can alter blood pressure, increase heart rate in some individuals, cause palpitations or insomnia. This is especially relevant for people with cardiovascular disease. Blood sugar effects. Ginseng may lower blood glucose. That sounds beneficial until it interacts unpredictably with diabetes medications. Hypoglycemia has been reported. Drug interactions. Clinically relevant interactions include anticoagulants, possible bleeding risk variability, antidepressants, especially monoamine oxidase inhibitors, stimulants and caffeine, additive effects, blood pressure medications. These interactions are documented in pharmacology references, not theoretical. Adulteration risk. Perhaps the most under-discussed risk, sexual enhancement supplements are among the most adulterated products on the market. Investigations have repeatedly found undeclared PDE5 inhibitors, synthetic analogs, variable ginsenoside content. This is a quality and safety issue, not a cultural one. Balanced bottom line. So let's be clear, without dismissing tradition or exaggerating science, what ginseng may help with: perceived fatigue, stress tolerance, general sense of vitality in some individuals. What it is not proven to do: increase testosterone, treat erectile dysfunction reliably, act as a pharmaceutical substitute. Who should use caution or avoid? People with cardiovascular disease, those on anticoagulants or antidepressants, individuals with diabetes, anyone using multi-ingredient sexual enhancement products. Tradition and science are not enemies, but they answer different questions. Tradition asks, what did people observe? Science asks, what reliably holds up under controlled testing? With ginseng, the gap between those answers matters. If you found this helpful, consider subscribing for evidence-based discussions on natural products, without hype, fear, or shortcuts. This video is intended for educational and informational purposes only. It does not provide medical advice, diagnosis, treatment, or individualized health recommendations. The discussion of ginseng in this video reflects current scientific literature, including human clinical studies, systematic reviews, and guides from authoritative health organizations. Scientific understanding evolves over time, and findings discussed here should not be interpreted as definitive or universally applicable. Natural products, including herbal supplements, are biologically active substances. Natural does not mean risk-free. Herbs can cause side effects, interact with prescription or over-the-counter medications, and affect existing medical conditions. Supplement products are not regulated to the same standards as prescription medications, and product quality, purity, and ingredient accuracy can vary significantly between manufacturers. Some products marketed for sexual enhancement or vitality have been found to contain undeclared pharmaceutical ingredients or inconsistent dosing. Any mention of traditional use, cultural belief, or historical practice is presented for context only and should not be interpreted as evidence of safety or effectiveness. Individuals who are pregnant or breastfeeding, have chronic medical conditions, or take medications, including blood pressure medications, blood thinners, antidepressants, diabetes treatments, or stimulants, should exercise particular caution. Before starting, stopping, or combining any supplement, it is important to consult a qualified healthcare professional, such as a physician or pharmacist, who can evaluate risks based on your personal medical history. This content is designed to support informed decision-making, not to promote or discourage the use of any specific product. Education empowers choice, but medical decisions should always be made with professional guidance.